to recent health campaigns, we all know about the dangers of smoking cigarettes. However, what's equally as bad for you is the alternative use, such as smoking shisha or chewing tobacco. The general misconception is that using these products isn't as harmful on your health, but when you use any tobacco products, you're putting yourself at risk. Cardio Wellness raises awareness and educates the community on the dangers and risks of chewing tobacco and shisha smoking.
I was smoking cigarette for 18 years, then I stopped it for 3 months ago, something. Then I started shisha.
I used to smoke shisha, or nargila, about once a week. I'd go with my friends on a Saturday night to a shisha bar.
Smoking and other related tobacco use are associated with 70 to 80% of oral cancer cases. The smoke and heat from cigarettes, cigars and pipes irritate the mucous membranes of the mouth. All tobacco products are equally dangerous, as they all, including shisha, contain more than 3,500 chemicals, of which 200 are toxic. These can cause heart disease, respiratory diseases and adverse effects during pregnancy. 43 of these chemicals are carcinogenic and are associated with lung and oral cancer. Oral cancer, or cancer of the mouth, is a world health problem with approximately 50% of patients only having a 5-year survival rate. Nearly 5,000 people are diagnosed with oral cancer every year in the UK. Most of these people are over the age of 40 and it affects more men than women. A change in the demographics of the disease is now being recognised, particularly in Europe, where it is increasingly being seen in young males.
I think I first had shisha when I was probably about 25, so probably the last 8 years or so.
I'm regular here. They got the best shishas, best flavour.
I think it's not as dangerous as smoking a cigarette, because shisha, it has water in the shisha itself, so the smoke goes to the water and it's a kind of filtering the shisha, the smoke that is coming to your mouth, but it's not as bad as the smoking.
The most common type of oral cancer is a squamous cell carcinoma. These are malignant tumours and tend to spread rapidly. At least 9 out of 10 oral cancers are squamous cell carcinomas and can occur in many parts of the mouth, including the lips, the tongue, the floor of the mouth, the inside of the cheeks and on the palate. Rarer types of oral cancer can involve the salivary glands and the lymph tissue at the base of the tonsils. There is usually no pain in the early stages of oral cancer, and the patient may not be aware of any symptoms. Clinical signs are broad and may be a chance finding during a routine dental examination. It could present as a painless ulcer that doesn't seem to heal, or pain or soreness that doesn't go away when you move your jaw or tongue. It may appear as a red or a white patch that cannot be wiped off, or a lump or thickening of a small area on the lip or tongue in the mouth. It could also present as numbness or abnormal bleeding or mobile teeth. If it has spread a little bit further, it may present as a lump in the neck.
I've heard there is some dangers, but then I've heard it's like 1/12 of a cigarette, so it's not too bad. Well, that's what I've heard, but I haven't really heard anything concrete about it, anything too bad about it.
It's not much danger because it's purifying the flavor, so it's not very dangerous. If you smoke couple of, say like every day you're smoking 5 times, then it's very harmful for you. But it's better than cigarettes.
No, I never thought that they'd have the same dangers as smoking cigarettes. But I mean, I guess it must do, because I've kind of developed this focused cough, and it can only be the shisha.
There is a common misconception that smoking shisha is less harmful than smoking cigarettes, but the potential risk is the same for both of them.
I'd like to go and see someone about it, because I think it's maybe time to quit.
And if you think chewing tobacco is less harmful than inhaling it, think again.
My mum and dad used to eat gutka when, they always eat gutka. So when I was younger, they used to give me pan. So that's kind of how I kind of started eating it, I guess. But, it just tastes nice.
Tobacco chewing is culturally and socially very acceptable in certain South Asian communities. This form of tobacco use is popular among ethnic communities with their roots in Central, South and Southeast Asia. Many South Asians believe it can help to aid digestion. The tobacco is added to a variety of products such as betel quid, pan masala, gutka and zarda. These products also include other ingredients such as betel leaf, slate lime and erica nut. Unfortunately, these products usually have little or no health information on their packaging.
I had no idea that it had tobacco and nicotine in it, so I'm a bit surprised to find out. I don't know what I thought it was, but I suppose I am used to eating it, so I can understand why now I might be hooked. I'd probably like to give it up anyway, because I have been getting some discomfort in my mouth, and I'd probably like to know how, if there's any help out there or anything like that.
Chewing tobacco such as betel quid, gutka and pan account for the high level of oral cancer found in the South Asian communities. The other main risk factor is alcohol. An excessive alcohol consumption, especially at the time as smoking or chewing tobacco, is associated with an increased risk of oral cancer.
You may think smoking shisha and chewing tobacco is less harmful, but actually, the health implications are potentially just as fatal as smoking a cigarette. For more information on the effects of smoking or chewing tobacco, please call the Cardio Wellness team on 0118 931 0361 or visit the website www.cardio-wellness.com.